Hello, everyone. My name is Javier Pinilla. I'm the senior member at the Moffitt Cancer Center, where I'm really on the head of the lymphoma program. And I have the pleasure to introduce today Arnon Kater from the Amsterdam University. Arnon, please go ahead, introduce yourself.
Yeah, so thank you very much for inviting. My name is Arnon Kater. I'm a hematologist here in Amsterdam in the Netherlands, and I am the head of the HOVON CLL study group.
Thank you very much, Arnon. It's a pleasure to have you today. So we're going to really discuss a couple of very interesting abstracts that was presented this year at the ASH meeting. And the first one is the long-term host immune changes following treatment with Venetoclax plus Rituximab in relapsed refractory chronic leukemia. So, Arnon, tell us about this study, and what will be maybe important for a CLL patient, considering that I understand that you have studied the immunity after the treatment with this very nice combination.
Yes. So the reason we were looking into this is that we have given Venetoclax rituximab in this trial. So to remember everybody, the Murano trial was a trial where was actually the first trial where a novel agent was given in a fixed duration time instead of continuous treatment like ibrutinib. And it was directly compared to chemoimmunotherapy. And it's also good to remember that this is not a first-line treatment that was given to relapsed patients, in patients that almost none of those had received prior targeted agents. And those patients got 2 years of venetoclax rituximab, and now years later, when this is actually now a standard treatment, we wanted to learn whether or not we saw late immune effects of this fixed duration treatment. So that was the purpose of this study. So what we did is we looked to immunoglobulin levels as a marker of humoral or B cell immunity. We looked to B cells numbers, T cell numbers, and NK cell numbers, and late adverse events. So if I quickly go to the study itself, what we saw here, let me just quickly get it up. Yeah, so what we found is if you look to immunoglobulin levels over time, we saw a recovery of both IgG, mostly important for long-term bacterial infections, but also IgA and IgM levels over time. And although IgG levels reduced significantly from baseline to end of treatment, because the venetoclax and also maybe more so the rituximab, of course, kills also normal B cells, we saw a recovering to baseline levels 24 months after stopping the treatment. What we also saw is that actually, in contrast to IgG, IgA levels went up from the beginning already and stayed going up until actually normal levels. And IgM also decreased from baseline during treatment, but also normalized afterwards. So that was on the immunoglobulin levels. And then if we look to B cell, T cell, and NK cells, what we know from CLL, and it sounds a bit counterintuitive, but T cells are actually elevated, increased in CLL. So of course, not in the percentages, because 95% or 90% of your lymphocytes will be B cells, malignant B cells. But if you look to the absolute numbers, CLL patients have more T cells. And what you can see is that during the treatment, you actually get a normalization of T cell numbers and also a normalization of NK cell numbers. And we know from other studies that it's not only a numerical normalization, but you also see improved function of those T cells after treatment. And we did not look into that in this study. But in conclusion, what we actually saw is that if you get the disease under control by a combination of targeted agents, venetoclax and rituximab, you actually see over time an improved and back to normal levels of both immunoglobulin levels, but also of T cell numbers and NK cell numbers.
Well, thank you, Arnon. I think it's very interesting for patients with CLL under this treatment, because I guess the hope is that they're going to really restore the immune system, and hopefully this will be followed by a decrease of infection. Have you seen, and I believe that there was read something about the infection rates after the treatment or during the treatment? Have you really see about that? Obviously, we now during the treatment is being reported, but you see any improvement of the rate of the infection after the treatment when the immunity is?
Yeah, I think this was not collected in a because it was in a very stringent way, because it was, of course, after the study was closed already. But indeed, the incidence of grade 3 infections, grade 3 or higher after stopping of treatment, was very low. And it was higher during the treatment than after treatment, actually showing indeed that if patients are under control after, because their disease is under control, you actually see a much lower rate of infections. And we know this is not only in the Murano study, it's true, but we also see in general that as long as the disease is under control, you also have much less of this immune paralyzement that you see.
That's a great point that you're making, and obviously we have to be careful during the treatment period when infections may arise, but it's always a really good word and the hope for patients who really undergoing to this time-limited therapy, because after that, as you just mentioned, the disappearing of the CLL cells may really improve the immune system, and hopefully in the future also be able to really get immunization to any of the pathogen that really around.
Well, and exactly, Javier, now that you mention it, I think it's also important. A lot of people worry or think about vaccinations, right? Can you vaccinate for corona, other vaccinations? And what we have seen in the studies, mostly from Israel, but also from actually many more groups, is that long-term Venetoclax treatment and ibrutinib treatment or other BTK inhibitors, although much better than chemotherapy, but they still, you see lower responses to vaccinations. But after stopping treatment, you actually see an improvement. And actually the fact that we show here in this poster on the Murano study that you get an improvement of immunoglobulins, I think is not a direct measurement, but of an indirect sign that indeed vaccination responses will also improve after stopping treatment.
Wonderful. Thank you so much for this wonderful presentation at US meeting. I appreciate that you're here today, and thanks again.